Well, in one line, I would say that you've heard people say before the risk to the average American is low. But I think what's important for people to understand is something could be low risk to you as an individual, but a higher risk to us as a population or a given population. And I think that's really the way to think about this right now. Certainly, we're seeing certain parts of the country at higher risk, and we're seeing certain vulnerable populations, older people, people with pre-existing medical conditions at higher risk. So to you, depending on where you live, the risk I think is still low. The risk is greater for you getting infected with influenza or seasonal flu, but that doesn't mean that the risk to certain populations isn't higher. You know, everyone's level of risk tolerance will be different. No one has a crystal ball here. No one knows what kind of travel restrictions may be put into place tomorrow or the next day. I think it depends on your level of risk tolerance, where you're going, what's going on there. Is it for business or pleasure? You know, there are so many factors in place here. And, you know, I can only tell you that if obviously you're thinking of going to an affected country where there's a travel restriction in place, the answer is no. If you're talking about taking an elective vacation somewhere where they have low activity and you're not personally worried, I would say go ahead. I have a lot of personal travel planned for work and one little vacation in the next 3 months, and I haven't canceled anything yet personally. Well, we're going to have a lot of myth busting tonight on the primetime special with infectious disease specialists and myself answering questions in real time. But I think we have to remember what will protect you from this and also protect you from common colds and influenza also protects those vulnerable populations. So hand washing, number one. I think what viewers are going to see tonight is not just a chronology of this outbreak since the beginning, but insights, analysis, and perspective that I think will really help put this into perspective, both for you as an individual and also for certain populations and our country and the world. So it's going to be really unprecedented in terms of all those different layers that we're going to be tackling. We need to test more people, and we need to test people who don't have symptoms to get a better handle on how prevalent or common this is. But that doesn't mean that right now, everyone with a fever or a cough can or even should be tested. We have to remember there's a saying in medicine, common things occur commonly. So based on your travel history, if you haven't been to an affected area or a country hotspot here in the US, meaning New York City right now and Washington State, you're much more likely to have any number of other respiratory viruses like flu than you are to have coronavirus. So we will be seeing some frustration occurring right now with testing, and that's making patients as well as medical providers nervous and frustrated. But we have to remember at this point, not everyone can or should be tested.